everybody has different kinds of scars, but there's some similarities in that an axillary dissection scar is often just underneath the armpit on the side of the breast. And mostly the doctors try and put the other scars so that you don't see them. So in this lady's case, it's just further down than that. So she's got 2 scars on the side of her chest. And both of these scars are well healed and look pretty good. Now, she does have arthritis, but her movement has really stalled and got worse since her surgery about 2 years ago. And when she takes her arm up into the maximum position, she feels pain just in that underarm area where she was just holding. You can see that location again when she goes to reach backwards. It's like it pings pain into that zone. When you have a close look, then there's this tight band that is right smack in the middle. So it's not the muscle at the front, it's not the muscle at the back, it's this structure that sits in the middle, and it's called cording. If you move the skin softly, you don't feel it. It can be really hard to see as well. But if you put some deep pressure to the side of that tight band and try and move it forward, it just won't go. It's so tight. This is a really thick cord. So it's not that string-like cording that might be 1 millimeter or 1/8 of an inch thick or 1/16 of an inch thick. It's really about 2 inches wide. That's thick cording. You can see it more clearly with your arm raised, and then use a hand to stretch the skin at the chest. And then what you see is the cord can pop out in that middle of the underarm. So not at the front of the chest where the pec muscle is, not at the back where the other muscles are, it's more in the middle. This is really thick cording. So the treatment needs to be right here, right where the cord attaches onto the scar tissue. And it's really important to get the direction of scar massage right. So each person is different. Each person needs an assessment to see which direction that tissue needs to be stretched. This is the direction for this lady. I like cupping because it's a way of stretching in a direction away from the body. But it's not very comfortable, so it can be done a bit later in the treatment plan. I'm demonstrating where the cording is connected to the body. What scar tissue is causing this to get tight. And where my fingers are palpating now, the lower hand, is where the axillary nodes were actually taken out. It's a long way from the axillary scar. It's about 2 or 3 centimeters, about 1 and a bit inches. So treatment can also happen here. If you can't get your arm as high as you used to be able to, and you've had an axillary node dissection, then it's a great idea to have an assessment, because not everybody has thick cording. So find a local therapist, a scar tissue trained oncology therapist, or if you want to, you can have an online assessment with me. In about 45 minutes, that's all it takes, we'll be able to work out if you've got any cording or what's stopping your arm from raising up easily, and then what you can do about it at home.